This is the posterior view of a scapula. Right here we have the spine, which leads to the acromion. And then if we turn it sideways, it does have the glenoid fossa, and you can see the coracoid process. This is the supraspinous fossa and the infraspinous fossa. And if we turn it towards the anterior view, you can see the subscapular fossa, and as you can see, the glenoid fossa, the coracoid process, and the acromion. Now we move on to the humerus. This is the anterior view of the humerus. We can start up with the head. The greater tubercle is right here, and the lesser tubercle is right here. The anatomical neck is right here, and the surgical neck is right here. Now if we go towards the center, you can see the deltoid tuberosity, and if we go down here, you can see the coronoid fossa right here, and the radial fossa right next to it. And if we go down along the head, you can see the medial epicondyle, the lateral epicondyle on the opposite side, the capitulum, and the trochlea. If we turn it to the posterior view, you can still see the trochlea, the lateral epicondyle, and the medial epicondyle. And then right here is the old cranial fossa. Right here is the anterior view of the ulna. As you can see, the olecranian process is right here. The trochlear notch, aka the semilunar, is right over here. The coronoid process is right here, and right along is the radial notch. This is the body of the ulna, the interosseous crest. This is the head of the ulna, and the styloid process of the ulna is right here. This is the anterior view of the radius. We start off with the head, which is a circular shape. This is the head of the radius. The neck of the radius is right along here. The radial tuberosity is a bump right along here. The body of the radius along with the interosseous crest. And this is the styloid process of the radius. Right here we have the anterior view of the hand, also part of the appendicular. We'll start with the thumb, which has the distal phalange and the proximal phalange, and the metacarpals. Phalanges 2 through 5 have a distal phalange, middle phalange, and proximal phalange, along with the metacarpals. The carpals are divided into 8 different ones, which start as like scaphoid, lunate, triquetral, which is underneath the pisiform. Then we go back to the trapezium, trapezoid, lunate, and hamate. Lastly, we have the clavicle. As you can see, this is a distal articulation which articulates to the acromion, and this is the proximal articulation which articulates with the sternum.